The real condition started to hit in 1996. And the heart condition then was found to be a blocked artery. I was told at the time, after the angiogram, that there was nothing could be done about that, but that I would just be living on medication and that would work. The pain never really was under control.
For the first time, went into a cath lab. The consultant did the angiogram, and at the end of it said, yeah, he said, you've one blocked artery. And he said, totally blocked. And he said, and the other one's about 70%. And he said, no, he said, it's not for me to say, he says, but I think the surgeon will say that he won't be able to operate on you. It's too dangerous. And the other thing is that stenting wouldn't work. And then he says, just go home and do nothing.
Previously, we would only intervene on arteries that were relatively straightforward. The disease was relatively focal. It was easy to wire, balloon, stent. I mean, in most patients that was transformational. But there was always a group of patients, particularly those with complex disease or chronic occlusions, where technically it was much more demanding. And so a lot of intervention was done partially rather than completely.
And Mr. Harper was clear to me he was feeling very restricted and frustrated with his lifestyle. He couldn't do what he wanted to do. Life wasn't much fun for him. But he was a little bit scared because when he came to me first, he was told there's nothing can be done.
Ian had no choice. Ian was told by two different surgeons several years apart that there was not an option for surgical revascularization. So he was faced with a very sort of stark choice. You know, you go home and die, or in hospital and die, or we try and fix him.
There certainly are a lot of patients out there, particularly patients who were assessed 5-10 years ago and said, you know, at that point nothing could be done safely would probably be the what people were said. I think we have moved forward. I think many of those patients can now be treated safely and see a significant improvement in their quality of life. You know, I think most patients, there's something we can offer these days.
James's intervention is incredible. I can't remember feeling so well as I've felt over these last few months. You want somebody who is going to do their best to get you back to your best.
When the final procedure was carried out, I was a completely new man. I came home, do you know what, I ran up the street. I could run up to the top of the house and back down again. Complete miracle, complete change of life and enjoyment. I just admire him so much. He saved my life.
I think we need to work very hard to make sure there isn't variability to access. And I think the way we do that probably is making sure not only do surgeons have outreach clinics, but there are cardiologists have access to interventional cardiologists who are able to provide these extra techniques. How does this patient get revascularized most safely, most effectively?
Several of the guys quite often come and join us. They bring their complex case, they scrub in, we help them work their way through the case, and providing support within a sort of network is the ideal model.
The solution should be patient-focused. And that means that it doesn't mean every doctor should have CTO capabilities or complex PCI capabilities, but it does mean every patient should have access to that type of care.
I'm an experienced cardiologist and I've got access to a huge amount of technology. But I refer patients to other cardiologists when I feel that cardiologist is more likely to do a better job than me and is more likely to be successful. We want to get the best care for our patients. We want to make sure that patients don't end up coming back. We want to make sure that patients have a good quality of life, and we want to make sure that they're safe. If you're going to move on into this sort of area of more complex angioplasty, there are no shortcuts. It is difficult, it does take time, but ultimately if you are able to learn the lessons and embrace the technology, you will see benefits going forward for your patients.